Hi, I am Dr. Deepak N Inamdar. I am a senior consultant orthopedic and robotic joint replacement surgeon. Today I am speaking to you about knee arthritis. There are various types of arthritis. The most commonly seen is osteoarthritis, wherein it's an age-related wear and tear seen in older people. So this is a very common form of arthritis. As one ages, you start developing knee pains. This starts at an age right from 25-30 years. So as you grow older and older, you start developing knee pains, and as you come to the age of 65-70 years, the knee starts bending and you start developing severe knee pain. The second form of arthritis is seen in younger people, mostly in females, called rheumatoid arthritis. You see pain in small joints of the hands also. So this form of arthritis, you develop early morning joint pains, which is more common in cold season or in the winter months. So these are the main types of arthritis which we see in the common population. The typical pain of arthritis is commonly seen either during colder temperatures or in the winter months. So in the summer months where the temperature is warm, the joints are more supple and the pain and symptoms of arthritis are much lesser. Due to the drop in temperature, the muscles become more stiffer, as a result of which the joints jam up and you develop stiffness and pain. This is more commonly seen in patients suffering from rheumatoid arthritis more than osteoarthritis. But this is a common observation that most patients have more pain during the winter months compared to summer months, or more patients have pain during colder temperature like in the early morning compared to afternoon. So as the day progresses, they become happier as the pain reduces. So this is a typical symptom seen more commonly in rheumatoid arthritis, also seen to a lesser extent in osteoarthritic patients. Arthritis symptoms are usually present throughout the day. The thing is, during the day, the patients are extremely involved with their work and with their activities, as a result of which they do not notice the pain. So once they go home or once they start taking rest, then they notice the pain which was usually present throughout the day, and the symptoms get exacerbated at night times. So this is not a thing that the symptoms are increased at night. It is just that the patients are at home and are able to have time for themselves, and then they see that they have more pain and more symptoms at night time. And during the daytime, whatever activity they have done, the activity gives rise to pain, which at the end of the day gets increased. Arthritis usually doesn't cause fatigue, fever or weight loss. The type of arthritis which causes fatigue, fever and weight loss is usually rheumatoid arthritis, wherein I have told you earlier, rheumatoid arthritis is where mostly female patients are affected. Young patients, the joint pains start by 25-30 years. So they are more commonly seen in early morning joint stiffness, small joint pains. So as age progresses, they start on various tablets or medication which are called as immunomodulators for control of the rheumatoid arthritic pains. So these immunomodulators also affect the immune system, as a result of which the patient becomes weaker and they develop weakness, sometimes fevers, and they are much weaker compared to the patients who do not take immunomodulators. So this is a very common symptom or sign seen in patients suffering from rheumatoid arthritis who are on long-term immunomodulator drugs or medications. The early signs of arthritis is called as chondromalacia. This starts at the age of 30-35 years, wherein patients come to me with pain in the front of the knee, or it's called as an anterior knee pain. This is due to the wear and tear which starts at 30-35 years right behind the kneecap, and the activities which increase this knee pain are repetitive knee bending exercises. Either the patients would have gone to the gym, or they would have done squats, lunges or yoga, padmasana or such activities which involves repetitive knee bending or maybe cycling. So these activities precipitate the knee pain, and these are the earliest symptoms. As age progresses by around 45-50 years, the pain spreads to the inner aspect of the knee because the weight bearing axis around 75-80% is on the inner aspect of the knee, and you start developing knee pains on the inner aspect. As you grow older and older, by the age of 60-65 years, the pain spreads to all the areas of the knee and you start developing deformities. The deformities which are commonly seen in arthritis are called either bow legs, which is very common, or in around 10% of the cases it is knock knees. So these deformities indicate the arthritis is long standing and the patient has been suffering from 10 to 15 years at a minimum with arthritic pains. So arthritis pain typically is like a pricking pain or a burning type of sensation. The sensitive patients who come early feel some sort of a burning sensation. They tell there is some burning sensation behind the kneecap, or there is some burning sensation on the inner aspect of the knee, or as it progresses you start developing a pricking type of pain. So these are the typical types of pain which is experienced in various parts of the knee, early on in the front of the knee, later on the inner aspect, later as you grow older all over the knee. So these are the typical type of pain seen. Arthritis, which is long standing over many years, and especially for patients who come to me looking for knee replacement surgeries, have deformities. The deformities, as I have previously told, most commonly is bow legs. That is the most common deformity which is seen in around 90% of the patients. In around 10% of the patients, you get knock knees. The other combinations which are seen in some patients, the knees are bent to various degrees. So these indicate a very long standing arthritis, and these make surgeries much tougher than when you come early on with lesser degrees of deformities. Arthritis over prolonged period of time causes one important disability. It reduces your walking distance. So a person who was earlier a community ambulator becomes a house ambulator. A person who was a house ambulator becomes ambulant only to the bed and bathroom, and as a result of which he loses his confidence over a prolonged period of time. So it is very early to recognize that the walking distance is getting reduced and get yourself treated early on, so that this reduce in walking distance or the reduction in walking distance is prevented, because this has a bearing on the health of the person. It has a bearing on the health of other systems, because walking is everything. Walking is important for your bone strength, it is important for your cardiac health, and important for overall health and wellness of the person. So when an individual is suffering from knee pain, which either is not getting reduced with rest, ice, physiotherapy or any measures, we would like you to come and see an orthopedic surgeon. The various tests we use to diagnose arthritis are: 1. We use weight bearing x-rays of both the knees taken in 3 special views, so that we get a 3D model of the knee and we can see in all the 3 dimensions. In some patients who are younger, we do a cartilage MRI mapping to see the amount of cartilage present. But in most older patients, it is pure x-rays which help us diagnose arthritis, and this helps to start the relevant treatment for that particular stage of the disease.